Hello ladies and gentlemen, please contact Professor Robert for a customized paper of the following or any other assignment. BHA-FPX 4002, Assessment 2. Changes in Medical Education. Write a 3 to 4 page paper to analyze the scope of change in medical education from the 1800s to today, the apprenticeship and academic models, and the importance of understanding the history in order to help improve medical education in the future. Jake is seeking a position in healthcare recruiting and human capital management. He is examining the many different professional roles that make up the healthcare workforce in the United States. He finds that clinical and administrative roles are significantly different today than those in the 18th, 19th, and early 20th centuries. Physicians, nurses, technologists, and many of the administrative positions today require state licensure, periodic revalidation, certifications, recertification, or registration in order to practice their profession. Throughout the ages there have been many landmark studies, reports, and events that have changed the course of history in medicine and medical education. The Flexa Report, 1910, reformed medical education and brought it to where it is today, Young and Croth, 2018. This report was the catalyst that pushed for legislation requiring physicians to be licensed. The report called for formalizing medical education and increasing the length of time in structured formal medical programs. This report has influenced medical education and licensing for all of the many different types of clinical, technical, and administrative healthcare disciplines of today. For your assessment, think about the evolution of healthcare education and its effect on the various clinical and administrative roles. Where does provider credentialing fit into the scheme of things, and why is it so important in healthcare today? How does today's fellowship training experience compare with the previous apprenticeship training experience? What are the innovative technological advancements that have elevated the healthcare professions and the clinics and hospitals that these professionals work in today? Reference: Young, K.M. and Croth, P.J., 2018. Saltz and Young's Healthcare USA. Understanding its Organization and Delivery, 9th ed. Jones and Bartlett Learning. Young, K.M. and Croth, P.J., 2018. Saltz and Young's Healthcare USA. Understanding its Organization and Delivery, 9th ed. Jones and Bartlett Learning. Available in the course room via the Vital Source bookshelf link. Chapter 6, Medical Education and the Changing Practice of Medicine, pages 141-167. Chapter 7, The Healthcare Workforce, pages 169-199. Quality of Care. This short interactive media activity gives an example of how medical training strategies impacted the quality of care for patients in a historical example. Artino, A.R. Jr., Severo, R.M., Desi, K.J., Hulbo, E. Anderning, S.J., 2018. Graduate Programs in Health Professions Education. Preparing Academic Leaders for Future Challenges. Journal of Graduate Medical Education, 10-2, 119-122. This article outlines the program requirements for health professions education. Harding, C., Bacabas, M. and Anderson, O., 2017. History and Outcomes of 50 Years of Physician Scientist Training in Medical Scientist Training Programs. Academic Medicine, 9210, 1390-1398. This article is about the elevation in the evolution of physician education. The next step in the development of physician education is to foster the growth of physician scientists. National Center for Complementary and Integrative Health. 2018. Credentialing, Licensing, and Education. https://www.nccih.nih.gov/health/credentialing-licensing-and-education. This website will be helpful in your research about the credentials required for current medical professionals, as compared to medical professionals in history. All medical providers of care must be licensed, certified, or registered practitioners. All practitioners must be credentialed with their hospitals, insurance companies, and other professional organizations for continuing education. The U.S. Bureau of Labor and Statistics. 2021. Healthcare Occupations. Occupational Outlook Handbook. https://www.bls.gov/shu/healthcare/home.htm. This website will be helpful in your research about current medical professionals, as compared to medical professionals in history. Use this site to find information about key healthcare occupations, job summaries, and entry-level education requirements. Scenario: imagine you are a medical apprentice in the 1800s. Envision your medical training during this era under the apprenticeship model. Jump to the 1960s and envision your training under the academic model. Finally, think of what your medical school training might look like today. Of particular interest for today's training are the many technology innovations for learning in medical schools, including augmented reality, Arkansas, virtual reality, VR, robotic-assisted surgery, and minimally or non-invasive procedure technologies. Today's training features remote patient monitoring, RPM, and telemedicine through a virtual model of care, VMC, as well as learning to use the human genome for more accurate diagnosing and patient-specific treatments. Instructions. Write a 3-4-page paper to analyze the scope of change in medical education from the 1800s to today, the apprenticeship and academic models, and the importance of understanding the history in order to help improve medical education in the future. Do the following. 1. The textbook is suggested as the most efficient resource for this assessment, or use other resources from those provided with this assessment. You may also use resources you find on your own from the History of Healthcare Research tab in the Healthcare Administration Undergraduate Library Research Guide to research the history of medical education from the 1800s, 1960s, early 2000s, and today. You will need to include 4 references in your paper, one of which can be your textbook. Use the course resources provided for the remaining references, or locate your own resources. 2. Write an introduction to your paper using the Changes in Medical Education template DOCX. Include a brief explanation of the purpose of the paper and its main ideas. Refer to the writing support page on campus for resources to help you as you write and revise your paper. 3. In the Changing Scope of Medical Education section of the assessment template, analyze the scope of the changes in medical education from the 1800s to today. How widespread are the newer technologies impacting medical training? Have there been mandated changes or have there been cultural changes that have impacted medical education? 4. In the apprenticeship model versus academic model section of the assessment template, compare and contrast the apprenticeship and academic models of medical education in the 1800s, 1960s, 2000s, and today. Describe the apprenticeship model and the academic model. Compare and contrast the similarities and differences in their features. Analyze how the models have evolved over time, and the impact the evolution of these models has had on the quality of patient care. 5. In the Importance of Understanding History of Medicine section of the assessment template, explain the importance of understanding the history of medical education, in order to help improve medical education in the future. 6. Write a conclusion to your paper in which you summarize the main themes you addressed. 7. Cite all the resources you used in your paper in APA format. Refer to evidence in APA and the Capella Writing Center for help with using APA style. Additional requirements. Your paper should be 3-4 pages, in addition to the title page and references page. Double space and use Times New Roman, 12-point font, as is provided in the template. Use a minimum of 4 resources. You may include the textbook and other course resources. Respond to all parts of the template, using the headings provided. Support all points with credible evidence, in the form of APA citations. Include a references page in APA format with appropriate citations. Competencies measured. By successfully completing this assessment, you will demonstrate your proficiency in the following course competencies and scoring guide criteria. Competency 3. Analyze the development of medical education in the United States. Analyze the scope of change in medical education from the 1800s to today. Compare and contrast the apprenticeship model and the academic model of medical education. Analyze the impact of the evolution of the models on patient care. Analyze why it is important to understand the history of medicine in order to improve medical education. Competency 4. Communicate in a manner that is scholarly, professional, and respectful of the diversity, dignity, and integrity of others. Articulates meaning relevant to the main topic, scope, and purpose of the prompt. Applies APA formatting to in-text citations and references.